it was born out of passion, out of the fact that I know what my father suffered, and I didn't want somebody else to suffer it. So I was ready to commit everything I have and everything I was to that mission.
To begin with, thank you very much, Sarah, for hosting us. Thank you, Natasha, the whole World Connect team. Everyone can hear me? It works fine? Okay. So tonight we are not going to talk about philanthropy in theory. We are going to talk about philanthropy for real. Through the concrete story, the personal story, and the story of impact of Dr. Lucky Aziken. So Lucky is a Nigerian ophthalmologist, but he's also the founder of VCGI, Vision Caregiver International, an organization that brings eye care to the communities that are so far away from it and that have no access to it. So as you will see, as we go through this discussion and as he tells us everything that he went through, it's a journey of personal motivation, of professional commitment, and of trust in local action when it's met with the perfect partners. And that's where World Connect comes into play. World Connect does not design projects from far away. It backs people like Lucky, local leaders who know their community, their cultures, their need, and they provide fundings, and more than anything, they provide trust, they provide flexibility, and the long-term backings that they need. So as you will see, VCGI, this is going to be difficult for me. VCGI, okay, I'll say V, you all know. VCGI is one of the many projects supported by World Connect, and we'll have a chance to discuss more of them with Natasha after the discussion with Lucky. But this is also a project that really illustrates what World Connect is about, and that's why we're so excited to have Lucky with us tonight. So Lucky, thank you for being here with us. To begin with, I would love you to give us a picture of what healthcare is about in Nigeria. Explain us what it is like when you need some health, some care, depending on where you live and depending on your age as well.
Thank you, everyone, for having me today. First of all, Nigeria is a very big country. We are over 220 million people. And there are about 34,000 primary health centers, which are supposed to provide primary care services in communities. But unfortunately, about 7,000 of them are the only functional ones. Most of the other ones are functional on paper. They don't work in real life. So that first is a major issue. But the second issue is primary health care in Nigeria focuses on maternal health, child support. There is no focus on primary eye care. So what that means, people don't really have access to eye care services in the grassroots. That has explained why we have a lot of people with visual impairment and blindness. About 4 to 5 million adults aged 40 and above have moderate to severe visual impairment. 1.5 million already blind, 3.5 million children under 18 have severe visual impairment. Unfortunately, 80% of the cases are treatable if the people have access. So because of the fact that there's no access to eye care services, people resort to local herbs, going to the bushes to get herbs to put in their eyes to see if that helps. We've come across a couple of them. So that's where it becomes necessary that we need to provide them access. That's where all of our work started from. And I have a personal story as well. I'm sure you're going to ask about that.
Yes, you're always one step ahead. Just before that, I want to stress that when we discuss, you mentioned those numbers, but also the fact that it's probably largely underestimated, because the surveys are not conducted when it comes to vision. So when the numbers you mentioned regarding visual impairments are probably much higher in reality.
Yeah. So the survey covered for people 40 and above, and then for children under 16 downwards. So there's a gap between 16 and 39. We don't know what's happening there.
So it's a real need that you went after. So I would like to take a moment with you, Lucky, to understand how come that you endorsed that mission. And I know, because we had a chance to discuss it before, that it's with you that is very connected to your personal story. So can you please recall us of what happened to your father and how this led you to do some medical study and ophthalmology and then to set up your NGO?
So in 2006, armed men came to our house and they shot my dad. Just more like local armed men. I don't know what they were actually looking for, but they shot my dad in the face, and he was able to get medical help almost immediately. So they rushed him to the hospital and he got medical intervention. He survived. But unfortunately, the hospital in our community, I didn't grow up in a village, I grew up in a suburb. So the hospital in our community didn't have proper eye care facilities. So because of the site of injury, which was close to the eyes, he needed to see a specialist. There is something called post-traumatic raised intraocular pressure. That's pressure in your eyes following a trauma. That's what he had. So he needed intervention, he needed drops to control the pressure, but because he didn't get access to specialist care, he lost his eyes. Very painful. At the time, I was trying to figure out what I wanted to do with myself, knowing that my father had just lost his eyes, and the other eye, he lost one eye, the other eye was already getting to look like it was going to go as well. The decision was simple. I needed to be the specialist he didn't have. So that was what this made me choose to become an eye doctor, straight up. So I said, this is what I'm going to do, and I'm only doing it because I want to save my father's vision. So I went into school, got admitted immediately, and I started learning way higher than my level because I wanted to be able to get to know what I need to do in the immediate time to help my father's vision. So I was meeting professors, talking about what could happen if somebody gets shot and all of that, just taking lectures from people above just to get to know what to do. Successfully, I was able to do that. But that on itself was a personal pain, but I didn't know how it affected everybody else until we had an opportunity to meet people in the communities, and I saw that my father's case was quite small compared to what every other person is facing. That's what changed to my purpose, which I'm working on right now.
Okay, but now you go too fast. So I'm gonna slow you down. So your father got injured so badly, and you decided to study to become an ophthalmologist. How did you jump from there to helping not only your father or your family, but realizing that there is a real need and helping so many more people?
So immediately I finished training, I decided to do a community project. I said, let me go to the community and provide eye care services. So I chose a community where I knew they didn't have access to eye care. And I was amazed at how many people showed up with walking sticks, and all they had was glaucoma. That if it was diagnosed early enough, they would have still had their vision. At that point, the pain and the agony made me realize that I needed to do something about this. It's not just about my father now, it's about this is common to everybody in this community. So that was where the whole idea to go into community service started. I'm slowing down.
Thank you, Lucky. And when we discussed, that's when I was like, wow, okay, I understand now. I mean, we'll come back to World Connect mission afterwards, but I understand what it is really to discuss with a real change maker, because endorsing such a large mission is, you're one of a kind, Lucky. So here we go, you decide to launch your NGO and to address the need of giving eye care to anyone in need in Nigeria. Yeah. That was the goal.
Yes.
Tell us about how you go from that big and beautiful idea to the very first step of building this NGO and making it real.
Okay, so when we went out to do community projects, what we were doing, because we saw how vast the need was, and there was practically no support, we were almost like the life givers of the people we were serving. So if we were not there, they are finished. That's how it looked. So we decided to move to the next community and then to the next community. So we just kept moving. So we stayed 2 weeks in a particular community, and then we go to meet the community leaders. We tell them we are providing eye care services. All we need is institutional support. Give us a space and help us share the news to everybody so they can come around. So they bring in their people. We start with health education, because most of the issues they have is ignorance. They are doing the things they shouldn't do. So we start with education, and then we provide comprehensive eye exam for all of them. And then we give the ones that require glasses, the ones that need eye drops. And then we finish that community and we go to the next community. We had done this within a 6 to 8 months period, and we decided to go back to the first community we went to initially. And we were amazed that the little progress we had made, we had lost it. The reason is because the people we gave drops to, eye drops, they said immediately that finished, they couldn't get it again. So, and some of these conditions require continuous care. So at that point, I knew that the plan was not going to work. Because if I go around all the communities, by the time I come back again, we're going to start from ground zero. So it didn't really solve any problems. So that was when I went back and said, we need to redesign this model and make it work.
And you say, we is you and who else?
Me and my team. So I have a couple of vision-minded people. At the moment, we are 6 that work closely with me, and we have some part-timers as well that come in as volunteers.
Okay, so it's people, ophthalmologist students or doctors already?
Doctors,
who
yes.
come and join you because you were leading the way,
yes.
But they come and join you.
Yes.
And at that point, there is no funding involved. It's you, no. Your time,
and my money.
And
the little money I had, yes. So at the time, because we really didn't, it was born out of passion, out of the fact that I know what my father suffered, and I didn't want somebody else to suffer it. So I was ready to commit everything I have and everything I was to that mission. So at the time, I had a little bit of savings that I was using for the project, but immediately the project began to make some good traction. People started seeing that we're making results, so we got community support. People started supporting from the communities. Oh, I could donate this, I could donate that. We could give you some materials you need. Some local pharmacies said we could give you some drops. So that was how it was sustained within the period until we designed our model.
So we understand that you were super passionate about it, and you were able to get some friends into it. But at that point, the model is not there yet.
Yes.
How do you get to have the vision of what it can become in a sustainable way?
Yeah. So when we came back and I realized that the model we're working with was not going to work, because if we move around, there are so many communities. If we move around and come back, we'll start all over again. So I started thinking, how do we make eye care available, affordable, every day? That was the priority. How do we make it available every day? Not just within a 2-week period when we're in the community. So somewhere I just said, okay, let's start a vision center, what you would call a treatment center, and see how that can run in hubs that can bring in people from the communities where we work, so they can kind of have consistent care. They can always come back for their drops if they run out, rather than waiting for us to come back in maybe, God knows, 6 months, 8 months time. So we started our first treatment center, a vision center, and the model was simple. The model is, because I didn't want a situation where we would depend solely on donor funding, which I know can be a little bit tricky. It depends on if the person is happy or is not happy. So if they're happy, they give you money. If they're not happy, they don't give you money. So I wanted a model that can work every day, so we don't have to think too much about it. So what came to my heart at the time was build a center that has all of what a typical eye center will need, so that people that have visual problems in the community that can pay can come into the centers to have their eyes tested. People that need glasses will get glasses, and they will pay. Out of what they pay, we can take care of people that can't pay. So that model worked magic.
So you were Robin Hood, in a way. You were taking the money of the one who can afford the treatment, and to make sure that the one who cannot afford the treatment would get it. And that all of a sudden it changed everything, because you have people staying on the ground, available every day, and being able to give long-term treatment to the population living in village, in quite remote villages.
Yes.
So that was the goal, and that was the first health center with a sustainable model. So first, congrats, because sometimes it takes so much time to find the model. You got it quite rapidly.
Yeah.
Now you've got one, and then two, and then three health centers.
Yes.
Do you want to discuss this? How you expanded?
Yeah. So at the time we started the first one, the pull, the traction was amazing. We were getting lots of people, not just because we were providing services, but we were providing excellent services. So the goal was designed, let's get them the best of services they need, so more people can come, because the more they come, the more we can get the people that can pay, and the more we can take care of the other people. So there was a little bit of traction, people were coming in, and then we spoke to a partner, Florida Africa Foundation, that, we have a center that is doing amazing numbers. We showed them the numbers, they were quite pleased, like, this is really good, because it was purely sustainable. It was a model that we didn't need to spend a lot to do good work, because everything was revolving around the money comes in and it takes care of people that can't pay. So they were able to support us to get the second center, and then subsequently we were able to pull up resources together to create the third center. So that's how the centers just opened up, and we made sure the centers were a little bit far apart, so it covers different catchment areas. People can go, if you can't go to center A, you can go to center B, or you can go to center C. So they are not all in the same environment.
So we, tell me if I'm wrong, Lucky, but I say this was 2018, was it?
Yes,
more
18 and 19, yes.
But quite rapidly, I mean, you could have expanded this model, but quite soon enough, after those centers had expanded, you decided to go and help a very specific category of people, the children at school. And it all happened because of a story again.
Yes.
So tell us that story and how life came and changed your plan.
Yeah, so when we're going to the communities, I was amazed that somebody came with a little child, an 11-year-old girl, and she said she's about to drop out of school. She doesn't do well in school. She's the backbencher. She's not doing academically well, so there's no need sending her to school. And I was like, you never can tell. Can we just have an examination and see what's going wrong? And to our greatest surprise, I put her in front of a chart, close your eyes, and she couldn't see. Close your eyes, she couldn't see. And I'm like, oh my God. And then we did all of the tests. We realized that she is a myope, -6 diopter myope, What that means, she can't see anything far away. And she's at the back in the class, so she doesn't see anything on the board. She has to copy from people. And that was the reason why she was about to drop out of school. So that got me really curious. At the time, I had gone to look at statistics of the number of people that have dropped out of school in Nigeria. It was about 13.8 million children. And I figured there could be a problem, a fundamental problem why these people are dropping out of school. It's not just lack of interest. That was where I now said, instead of thinking just about providing access, how do I help these little children in school that nobody wants to help? Because at the moment, people feel they don't want to go to school. So I came up with a project called Vision for Kids and Teens. The idea was to go to schools, educate school teachers and nurses on eye care problems, train them on how to screen children that have eye care problems, and then give them a referral form so they can refer those children that failed the test when they screen them to us, and we can provide them what they need so they can go back to school. That was the idea of the project.
So I think he deserves a round of applause. I'm sorry. Just to add on what you say, I understand that this program with teachers run not too far away from the test centers to make it work.
Yes.
And that you have tested, tell me if I'm wrong, 45,000 kids?
45,000
people,
yeah.
45,000 people altogether since 2018. So that works at scale. But here comes the need for funding again.
Yes.
So tell us, when you realize with these girls that there is a need, desperate need, because now we are talking of really changing life of children. How do you see, and you have the vision of how to leverage on teachers, but still, you do need equipment, you do need funding. How do you see that funding coming?
And so when the project idea came, the first thing I was thinking about is we needed to locally produce this testing equipment so we can distribute them to schools. Because if we're going to import them, it's going to cost a fortune to be able to set them up in schools. So we needed to produce them locally. So I made all the researches and did all the figures and numbers that we need. And at the time, we didn't have enough resources to pull that out. So I started reaching out to development organizations. Oh, I have a brilliant idea. This can solve problems for children forever, because once you do it, the school runs it on their own, independent of you and all of that. But surprisingly, most people didn't think it was necessary because it didn't have a lot of glam around it, because we're going to go to schools and teach teachers, so it really didn't fit into most of their priorities. So I met up to 3 different organizations, and I was getting a no. So at the point I was angry. What makes visionaries? Visionaries can be. I was angry with the stuff that this can be done. Why don't just you believe that this can be done? But I wasn't getting the support. So we started a fund, started saving money from the little money we were getting from the center, saving money on the side. So this is going to go for the Vision for Kids and Teens project one day. As much as we can, we'll keep saving until we're able to pull it off. But at the time, I heard about Word Connect. And I'm like, okay, let me give it a try this last time. If they don't agree, I keep saving the money. When it gets to the point where we can do it on ourselves, we'll do it by ourselves. Surprisingly, in a week, I got the response, yes, we will. And I'm like, oh, so somebody thinks that this is possible, like I do. And that was how my partnership with Word Connect started. And it's been amazing.
So congrats, Word Connect. And what we see here, and we'll discuss it further with Natasha, but what we see here is really an illustration of how Word Connect function. You mentioned that you had your own funding. Word Connect provide fund and expect the project leader to have its own funding as well, so that everyone is committed. and as you mentioned, it's fast, and they are here to back you.
Yes.
So you had been working with other donors before, and you had knocked at other doors.
Mm-hmm.
Anything else that you want to add on World Connect specificities, its way of working, from your experience?
Yeah. So one thing that makes World Connect stand out is the fact that they think community ownership. They want something that is sustainable, something that works as a self-reliant thing. So those are things I read about. I'm like, okay, these people really think about sustainability and making impact. And beyond just, there's one thing to offer grant, and there's another thing to offer partnership. They are not the same. Sometimes most organizations give you grant, they give you money, and you don't have any support or any connection or any partnership or any relationship. What Connect provides you with relationship. So it gives you confidence to go out in the community knowing that you have a partner that you can always run back to when things go wrong or when you need any extra support. I had the privilege of meeting Pamela, Patrick. Most of the people I work with, I don't get to meet their CEOs. I just know that you submitted to a program coordinator, and the program coordinator replies your email, and then they tell you, give us our report at the end of the project, and that's all. So they cut you off. But I was able to meet with the CEO, sat at the table, we talked about all the things, all the beautiful things that they are doing around the world. So it's more like they provide you with partnership and not just grant funding, which is quite different.
Perfect. Nothing else to add. Lucky, what are your ambitions for your NGO for the years to come?
That's a big one. As you can tell, we're dreaming really big. The priority for the centers, we want to make them 1,000 centers. I don't know how long, but we're patient enough to work at it. If we can get 1,000 centers, that means everybody will have eye care service everywhere at every time. And it will cover the different areas across the country. We invest heavily in technology, making sure we get up-to-date equipment so that the right people that can pay can come to us, because we depend on them to survive, to pay other people. So we spend a lot of money buying equipment. So we would always be thinking of what's the latest equipment. All of my travels and everything, I am always on the lookout to learn new techniques, new technology. What can we bring back home that people can get to want to experiment? And that can bring the right people. So we spend a lot of money on equipment. So getting equipment, like I was telling you when we had the chat, setting up a center is, if it was just opening up a room and having a table and a chair, we'll probably have 1,000 by now. So it's more than just a room and a table and a chair. It has all of the gadgets you would naturally have to test the eyes, OCT, autorefractors, and everything that you probably have here, we have most of them there as well. So that whole setup, getting equipment, it's something that we are quite passionate about. And then the other thing we're passionate about is getting to reach more schools. The project we had to work on it, we did it in 10 schools. We trained 207 teachers and school nurses, and they screened 1,786 students. And they also made a commitment to make the screening a part of entry requirements. So anybody that gets admitted into the school goes through the screening. So that means the number at the moment is quite higher than what we have. So it's a huge plus.
So a lot to come. A last question, Lucky, and then later on we'll open the question to all of you, so we'll have a chance to ask your own question to Lucky. I'm sure you have. One last question from me. What is it that you want to say to everyone who is listening to you today?
The world will change the moment someone here realizes that if you don't stand up for this, nobody else will. I would hope that my story and the impact we're making will inspire you to either stand up for a cause you care about or to support those that are standing up.
So now it's on your shoulder. Thank you, Lucky. Thank you very much for your testimony. just amazing, and I hope you have all the expansions that you expect for your NGO. Thank you so much.